I was curious, like what went down.
Yeah. And this one happened this year, I think. It was so in post-acute healthcare, and I think maybe hospitals, but definitely like in home health, hospice, skilled nursing facilities. A lot of states have this concept called a certificate of need, which is like your right to operate healthcare in a certain geography. Think of it as like your liquor license in Philadelphia or your taxi medallion in New York, right?
Yep.
It's a limited, thing that lets you operate. And states will allow you to apply for one, and sort of it's a public process. You kind of have to prove to them that another one needs to be issued. But there are some states where they've said, hey, there's enough providers in the market, and they're restricted. We're not going to issue any more. The only way you can get one is to buy one. And so it's like it's a moat, right? And so when they come on the market, it's rare. And when they do transact, it's usually privately. So there's like no public data about it. And so the only sort of way what they're worth is maybe what you paid for the last one.
Wow.
And so, but it's all really in the eye of the beholder, right? You're buying a right to operate, which, for one operator may be worth millions and another one may be worth tens of millions. Like it's all in the eye of the beholder. Anyway, what was crazy about this deal is one came up, and it was for someone doing skilled nursing services, which is not a CON service usually. But they said they had a CON that was grandfathered in the 70s. That's like when the concept came about. And they were actually pricing there was a broker, a local broker, who said they'd done these before. We're pricing it based on, hey, this is a rare opportunity for a CON in this state. These never come up for market, and we're going to price it at some number. And so that was part of our strategy.